Hello everyone, it's Ravi from the Royal Pharmaceutical Society and I'm back today with one of my daily COVID-19 updates. There have been lots of announcements from government and the NHS over the last 24 hours. I will touch on some really key points that I thought would be quite relevant for everyone, but there's lots of other information available on the RPS website for you to access when you have a moment and some time. Key announcements and publication from government. There's been a new GB-wide PPE guidance for frontline staff that's been published yesterday. The RPS was involved in this consultation process of the guidance, and it's great to see the guidance recognise the valuable role of pharmacists and their support teams in the fight against COVID-19. The RPS is now updating a PPE FAQ section of our website to help explain what this will mean for you and your teams and when it's appropriate to use PPE as well. There has been emergency legislation that has been put forward to enable flexibility around the supply of controlled drugs through pharmacists and pharmacies. RPS has been calling for greater flexibility around medicine supply situations to empower and enable pharmacists to do this without going back to the original prescriber. And so this move is great to see, but what we would like to see next is this being extended to general medicines, including inhalers, blood pressure medicines, for example, to ensure that people have access to medicines without needing to go back to the original prescriber, particularly for minor changes and alterations such as quantities, formulations, for instance, as good examples. Yesterday, the Royal College of Anaesthetists have also published a couple of new clinical guidances to help with the management of critical care situations during the COVID-19 pandemic. There's been stuff around the use of anaesthetic drug uses and administration, and some information and guidance around the adaptation of standard UK critical care medicine prescribing and administration practices as well. So once again, do check that out. That's available for everyone. That's also on the RPS website. We've just come off a really positive meeting with the Pharmacy Minister Joe Churchill, raising a number of points that have been brought to our attention by members and the profession, and particularly around a further update on our policy asks. We have pushed for further information around clarification around Easter bank holiday opening times and hours, and also we've pushed for further information around the NHS delivery service and when this will be announced. We've also raised key points around protecting pharmacy teams even further, particularly around COVID-19 testing implementation following Matt Hancock's announcements yesterday evening. When is that likely to take place? How is it likely to take place as well, and how pharmacy teams can get involved. We've also talked about current and future supplies of PPE following the new Public Health England and GB-wide guidance on PPE that was published yesterday. Joe Churchill did clarify that pharmacy teams are on the list of key people to receive COVID-19 testing, so this is something we've been pushing for, and it's great to hear that, and so we're expecting further information around this very shortly. We've also had some really positive responses from the Minister and the Department of Health colleagues around protecting the mental health and well-being of pharmacy professionals on the front line. Hopefully some new information and some progress will be made on that next week, so we'll keep you posted. There's also recognition from the government that there is a need to ensure that all health workers, including pharmacy professionals, are able to have free movement between their home and place of work if more stringent measures come into place around self-isolation and staying at home. So they're working with the police, working with the Royal Pharmaceutical Society to ensure that happens. Key RPS updates. We're currently in the process of drafting a new set of FAQs on clothing and infection control, so keep an eye out for that. The RPS and the GPAC have produced a joint letter which is actually on the RPS website right now to all law enforcement officers to explain that there should be no issues for pharmacy professionals to move from their place of work to their home on a day-to-day basis. So once again, do check that out. That's available for all pharmacy professionals from the professional leadership body and the regulator. We've currently refreshed our tips on social distancing in community pharmacies, but also those social distancing requirements also apply to anywhere else within pharmacy settings and other healthcare settings in line with Public Health England. We're also adding a new hospital pharmacy FAQ section to the coronavirus hub page as well, so keep watching this space. We've done some few updates, but as it's an ongoing process, more will be added to it. It does feel like another really intense week, and I'm sure it does for many people on the front line at the current moment in time. I know it may not be feeling like it's getting any easier, and I do really understand that and understand what you all are going through. But I can assure you, from what I've been hearing, the response from all of you and your support teams has been absolutely incredible. What you guys are doing now will be remembered for years, decades to come. You're all doing an absolutely fantastic job, and we really recognise that here at the Royal Pharmaceutical Society. Your professionalism has been heroic. So once again, thank you from us to all members of the pharmacy and healthcare family for all your incredible work that you're doing on the front line. I hope you manage to get some downtime and rest this weekend where you can. Please stay safe, and I shall speak to you all again on Monday. Thanks.